So let's talk about the differential diagnosis of the retroperitoneal mass. The first differential would be lymphoma. So you should ask about the multiple lumps in the body for lymphoma, or soilings in the body, multiple soiling in the body, and along with the fever. So ask about the history of the fever and fever with soiting and chills and rigors. So these questions you should ask with the fever. And this thing is very important. The patient usually complains about the drenching soiting, that his or her clothes and the bedsheet is wet with just because of the soiting. Okay, so second differential would be liposarcoma. So ask about the repeated episodes of syncope and low sugars, vertigo, fainting. So these symptoms are very important because liposarcoma releases insulin like growth factor. So third differential would be paraganglioma or neuroendocrine tumor. So for paraganglioma, ask about the high blood pressure. Fourth differential would be neuroblastoma. So ask about the fits in childhood. And the other would be pheochromocytoma, germ cell tumor. So for pheochromocytoma, again high BP, and for germ cell tumor, precocious puberty. So these questions you should ask in the differentials. So then come to the risk factors. Okay, ask about the trauma. Take trauma history, back trauma, lower back trauma. Second would be radiation exposure. Third would be chemical exposure. Like if the person is working in a polyvinyl chloride plastic factory. Ask about the familial tretinoblastoma. Ask about vision and cat-like eyes. Then the fourth thing would be Lee-Fromenai syndrome, in which there is P53 mutation. So ask about the blood CA, breast CA, kidney CA, and kidneys here, basically it's adrenals here. So this is very important. Okay, so continue with this. Ask about the risk factors. Risk factors are very important, but sorry, we have these are the risk factors basically which we are discussing. So continue with the risk factors. Next would be about Gardner syndrome. So you ask about the intestinal mucosal neuromas, bleeding per rectum, and lumps in the body, and so these are very important. And seventh thing would be family history of intestinal CA, breast CA, blood CA, and thyroid CA. Ask about the splenomegaly and hepatomegaly. So we summarize the differential diagnosis and risk factors of the retroperitoneal mass. I hope it will help you in taking history of a patient who came with the abdominal mass and you are considering as a retroperitoneal mass. If you guys want to add some other things, so we will discuss about it further. And our next topic would be history taking from a patient who came with the right upper quadrant pain. So we'll talk about the chorelithiasis. So stay tuned for the other videos, and just comment in the comment section and subscribe my channel. Thank you. Bye bye.